Hello, Dr. Glenn, resident vet for Vet and Pet Direct. How do I treat my dog for tapeworms? Lots of different products to treat your dog for tapeworms. There's three main tapeworm species that we need to worry about in Australia. Flea tapeworms are the most common tapeworms that we see. They are nasty little buggers that get in through your dog eating fleas or chewing at fleas, and then they become infected. All the tapewormers kill flea tapeworms, and they're quite easy to kill. NexGard Spectra has got registration for the control of flea tapeworms. Doesn't actually kill the tapeworms, but it does a very, very good job on controlling the fleas that cause tapeworms. So if your dog hasn't got fleas, you can't get flea tapeworms. Otherwise, all of your preventions will kill flea tapeworms at the normal dose. Some of the preventatives that do heartworm prevention as well have got a tapewormer in them, like Interceptor. You can get just a straight tapeworming tablet called Papantal. That one is 1 tablet per 10 kilos body weight. And for flea tapeworms, we usually recommend an interval of every 3 months. One of the other main flea tapeworm species is Spirometra tapeworm. Spirometra gets a little bit complicated because they are a tapeworm that comes from little microscopic crustaceans and up the food chain, anything that eats those. So that looks like little slugs and insects and lizards and birds that eat slugs and insects and then end up in your dog one way or the other. The complicating thing with Spirometra tapeworms is that you need 4 times the tapeworming dose to actually kill them. Only need a one-off dose, but you need 4 times the tapeworming dose. Your regular all wormers that have got tapewormer in them probably makes more sense to use 4 times the dose of just a particular specific tapeworming medication that does just tapeworms. So pretty much Papantal tapewormer, it's 1 tablet per 10 kilos as the normal dose, but you need to give them 4 times the dose there. So if you've got a 30 kilo dog, you're actually giving a 120 kilo dose. So 1 tablet per 2.5 kilos body weight. None of the tapewormers have got any residual effect, so you need to worm them frequently enough that it stops causing any disease, basically. Hydatid tapeworms are a tapeworm risk for people primarily, but also to the dogs as well. If you're in a hydatid tapeworm area, you need to use a regular tapeworming dose, so with Papantal, 1 tablet per 10 kilos, or your regular dose of the all intestinal wormers. You need to do that every 6 weeks to treat and prevent Hydatid tapeworm. Bit of a complicated topic, but basically if you see a tapeworm hanging out your dog's butt, certainly it needs a tapewormer. If you have got concerns that you've got tapeworm disease in your pet, as in you've got gastrointestinal upset symptoms, failure to gain weight, or is losing weight, certainly a vet visit would be recommended. Hope that helps. Thanks, guys.